Happy Sunday to my center stagers. Welcome to Dr. J's Prescription for Health. I am your host, Dr. Malea Jensen. We are live on Instagram and YouTube this morning. As a reminder, this is not medical advice. I am a doctor. You guys are patients of somebody, but not my patients. So the disclaimer is this is not medical advice. It's for information and a little bit of entertainment purposes only. So keep that in mind, but this is your opportunity to ask questions regarding your health, your labs. Keep everything simple and succinct if you would like. There are a lot of questions that pop through. Put QQQ in front of it so I know that you're actually asking a question. Good morning, Instagrammers. Good morning, YouTubers. Thanks for joining. What do we have for questions this morning? Anyone who wants to be first? Oh, here's a good one. I love when we start this out. So this is great. Is it safe? Is it safe to eat grocery store meat? Well, yes. To be simple, the answer is yes. You are going to have some carnivore Nazis or carnivore ketos, people that are out there telling you that organic grass-fed beef is the only thing you can eat and you should not ever eat grocery store beef. And well, I guess that would put you at a disadvantage and you might as well consume plants, and I don't recommend that. I know that, let me shift my light here, hold on. There we go. I think that I can actually reach it from here, from my desk. So usually I can't, but this time I can. So that makes it a little bit better, you guys. I am live on Instagram and YouTube this morning. So I know that a lot of you have heard that in grocery store meat, there'll be hormones, there'll be antibiotics, but I need you to understand that, let me give you an example. You go to the doctor, such as myself, you have sinusitis or strep throat, and I put you on an antibiotic. When I put you on an antibiotic, do I just give you a one dose antibiotic and it'll be in your bloodstream for life? No, I dose it 1 time a day, 2 times a day, sometimes even 3 times a day in order for it to work, because it has a half-life. It's in and out of your body just like it's in and out of a body of an animal. Same thing with hormones. If I put you on a hormone, you're either going to get pellet therapy or you're going to get topical therapy or you're going to get weekly therapy. But men don't just dose testosterone on a one-time shot and it's good for life. No, they have to do it for every 1 week in order for it to stay in their system and contribute to their healing. I don't believe that we need to be as fearful of hormones and antibiotics in our meat. You know, eating that meat is better than eating no meat at all. How about that? And we need to keep this in mind. These things are given daily. The reason, here's the reason that they're giving these things. These animals are in confined areas. That's why I don't want you eating grocery store meat, is because you're buying from farmers who cultivate these animals in tiny confined spaces, feeding them crap food, not even food, it's crap, grains, and they're getting sick. And so they have to give them antibiotics and they have to give them hormones. They don't have to, but they choose to. So they'll get them big and fat and get to slaughter faster. That's what's going on. Not the fact that you personally are worried about the hormones and antibiotics in it. I'd be more worried about the animals. That is what's sad. So that's why we need to order or buy our meat from regenerative farmers. They're using the land. They're not using monocropping grains for their animals. And I know it's tough, you guys. It is tough. It's hard to find these farmers, but please, please, please don't be afraid to eat grocery store meat if that is all you have. Good morning, Philip. Lucy, I am glad to see you on here this morning. I have something that I think will make you smile. Yesterday, when I was with my mom, we were just getting done from an event that happened to be very, very close, and I could walk her to the event. And we get back and we were talking about the live stream from yesterday. And you know what she asked me? She asked me, how is Lucy doing? Like out of the blue. We have never talked about Lucy before. And yeah, my mom is usually listening. I haven't seen her jump on here. She might have forgotten. But Lucy, I just want you to know that we were thinking about you yesterday, and we pray that your healing is occurring and that you are getting through all of this therapy. And yeah, you're in our thoughts and prayers, okay? So you guys pray for Lucy in California. Lucy is going through some health concerns, and we are confident that everything is going to be good. All right. Next question. Let me make sure. You guys on Facebook, or excuse me, on Instagram, the questions come much slower. So that's actually good. Oh, I think of her too. Well, thank you, Lucy. I will tell her that you said that, because that would mean a lot to her. She has a lot of fans on here. My fan patients. So that's kind of cute. All right. Let's see. Oh, here's a good one. I've been told that my skin symptoms are related to what I'm eating. Is that true? Yeah, I think it is true. Your rashes, for instance, like on our neck, there'll be sometimes a dark pigmentation on our neck. It's called acanthosis nigricans. And that is very common in people who have insulin resistance or even diabetes. So it is a common condition. Same thing with skin tags. Those are very common with diabetes and insulin resistance. So things on our skin, even rashes like rosacea, that could even be a sign of iron overload. We need to look at these things with our skin as signs of something else that's going on inside. Remember, things that go on in our gut can come out in our skin. Our gut is our immune system, part of our immune system, one of a big area of our immune system. So what goes on in our skin is what's likely resulting from what's going on in our body. Same thing with joint swelling. That is a sign that you have inflammation in your body, usually something that you're eating. So what you eat comes out in our joints, our skin, our bowels. Having gas and bloating is not normal, you guys. That's inflammation. That is from things that you are eating. It is not normal. It's easy for a doctor, and I am one, it's easy for a doctor to give you a diagnosis of IBS, irritable bowel syndrome, and then just give you a medication for your IBS. You either got diarrhea or you got constipation, predominantly diarrhea or predominantly constipation or a mix of both. That is what you're eating. Not once did that doctor tell you about ask you about what you're eating. The only time that they ask what they're eating, and we get checkpoints. So if you are asking about what a patient is eating, like in the preliminary paperwork, we actually get checkpoints for that. And we will simply ask questions like, what do you eat? But we're never going to mention anything. If you say, oh, you know what? I'm eating some Oreos and Doritos, and I'm eating mac and cheese and bread and all of these things, potatoes. We never say a word. Doctors don't say a word. But if you mention the word keto or ketovore or carnivore or a lion diet, you better be prepared for some backlash. Explain that to me. We're more worried. Doctors are more worried that you're on a ancestral proper human diet instead of eating fake food. There's no nutritional value in fake food. It's processed. They're happier with you eating macaroni and cheese than eating a steak. It's unbelievable. That's because doctors have never been trained. Lucy says she's so blessed to have you. As a mom, I know the joy of having a daughter that truly cares about us. Yeah, I think my dad would agree too. Okay. Yeah, Al, I would agree with you. That would be a step in the right direction, is stopping all those medications as well. Fire Tiger asks, do I have to eat meat? Currently vegan and thriving. Fire Tiger, I think if you are skipping down the street, singing a happy song and feeling great on a vegan diet and thriving, then there's nothing that will speak to you otherwise except for how you're feeling. There are a lot of things as physicians that we can look for to, as far as labs are concerned, that I think should be looked into, because I think you should know. I'm hoping that you are supplementing your food. Exactly, Lucas. Make sure that you keep the protein, B12, and iron up. I agree, Lucas. He's talking to Fire Tiger, and I would agree wholeheartedly with that sentiment. So, Fire Tiger, it appears that if you're thriving, you're getting enough protein and B vitamins and fat. I'm guessing you're getting essential fatty acids and essential amino acids some other way, and that's great to hear. Pajal says, what kind of doctor are you? I am family practice. You guys, if you could put QQQ in front of a question, I can find it easier. JM asks, do you think there are serious differences between giving an infant formula over breast milk after the first 2 months? I absolutely feel that there is a difference. Formula is fake. It is full of fortification of synthetic vitamins. It's full of sugar and carbs that a baby does not need. It's full of denatured amino acids. It is not human breast milk, and there's nothing better than human breast milk. There is nothing better than human breast milk. You would be better off if that baby can no longer, if your question is, my baby can no longer breastfeed after 2 months, one, I would ask why, and I would get that evaluated. But two, I would say, what is in a formula that would encourage you to take that, except for you've been told that formula is okay. If you look at the amount of non-heme iron, what we call synthetic iron that is in formula, you are poisoning your baby with non-heme iron that will be in their system for a lifetime, unless of course they get treated for it. But we should never be feeding our babies with fake formula. We should be giving them chewed up liver pate or steak that we've mouthed and gummed in our own mouth, and then give it to our baby. Break it down, give it to them in a pate. And that egg yolks, they're very good. They raise chickies on egg yolks, right? A chicken, their eggs live and grow outside of their body. They do not need the mother bird. I know that we are not mother birds, but we are the same in fact that we can eat the things that, if a chickie can live outside of its mother's body, that means a chickie egg has everything that it needs and we need in order to live. So chicken eggs, poultry eggs, turkey, any kind of bird. Robin eggs would be healthy for us, but we choose to eat formula, and yeah, not a good thing. Al says we have to make RFK the president. Let's see. More questions, you guys. Oh, here's a good one. Do you have to wean off of SSRIs or SNRIs? Serotonin, norepinephrine reuptake inhibitors, and selective serotonin reuptake inhibitors. Those are depression medications. And yes, they need to be weaned off of. You should not, although in my practice, I have had numerous patients cold turkey off of their SNRI or SSRI, antidepressant or anti-anxiety medications. It's unbelievable, and not once have a side effect. I don't recommend that. I do recommend weaning off, and I recommend weaning off very slowly. I had a patient who was on Effexor at one point, and Effexor you can get at a 75 milligram dose, a 37.5 milligram dose. That's how we titrate up. So with Effexor or venlafaxine, The lowest dose is 37.5 milligrams. Then it's at 75. Then you go to 150. You got 225. I've even had patients on 300 milligrams of venlafaxine. That's a very high dose, and it starts to hit the norepinephrine receptors in our body. And these patients can get hot flashes. They can get they can get even more anxious. So I don't ever recommend going up that high. That's psychiatrists are using doses that high. Most patients are on 75 to 150 milligrams of venlafaxine. It's a very great, a good medicine for hot flashes. I'm not a promoter of medicine. I think that our diet is cause for concern, and that's what's causing a lot of our problems. And we lean on medication because our doctors or society tells us that you have a problem, here's a medication for it. I don't agree with that. But when you're weaning off of something like venlafaxine, good morning, Christy. When you're weaning off of venlafaxine, I had a patient who was, we lowered the dose to 37.5 milligrams. They were breaking the capsule and counting the beads. In venlafaxine, it's not a powder, it's a bead. And they were counting them out. And they got down to 20 beads, then 15 beads a day, then 10 beads, then 5 beads. Then they were down to like 1 or 2 beads. Can you imagine the minute if they were to just go off of 37.5 milligrams or even pour out half of a 37.5, they got withdrawal symptoms. And what does that feel like? It almost feels like what people have described to me is like what they would call a head bomb, where it feels like your head is going to explode. And it's not like a pain. There's no pain. It's just like you are out of reality or something with your head. And it can cause nausea. You feel like you just need to get more of that effexor to relieve those symptoms. Sometimes it's described as a headache, a dull headache. Like it's not painful. It's just like a dull headache and it won't go away. But the minute you take more beads in the venlafaxine, then the symptoms go away, which is, I don't know. It's you guys, it's up to you, but weaning, please wean off very slowly. Lucas says, I'm a vegetarian and that is a major part. Yep, it is. JM, I think I answered your question on the breast milk. Raymond asks, what is good for diverticulitis? Oh, here's a question. Why aren't you doing super chats? I will in the future, but you need a certain criteria on the super chats in order to garnish that. And so since I just started doing YouTube, I do not qualify for super chats yet. You have to have certain qualifications, and I will get there. I'm sure that I will get there in the next few months, and then super chats can start. But right now, I'm answering everybody's questions as long as I have time. So going now with Raymond QQQ, what is good for diverticulitis? Think about diverticulitis. Itis means inflammation. So you have inflammation of your bowel, your lining. What happens with diverticulitis is you actually have diverticuli. And these are outpouchings or inpouchings, however you want to say, but they like little caves inside your large colon. Usually the place where they're most common is in the sigmoid colon. So the sigmoid colon is little s that's on the right-hand side of your colon, or excuse me, the left-hand side of your colon as it enters into the rectum, and it gets inflamed. So we get these little caves, and when we eat something, the debris of the food can come and settle in these caves. And then that debris ferments and decays and can lead to inflammation. And an inflammation of a diverticulum is a diverticulitis, inflammation of diverticulitis. So something caused your outpouching. So let's go back to the cause. That's diet. Eating refined foods is a big problem. But now anything you eat can get into those diverticuli and cause a diverticulitis. Things that are high in fiber, they say is good for you, but eating things that we do not digest, that only our microbiome digests, can get stuck in there. That's any plant food. So my recommendation for diverticulitis, in fact, when you go to the hospital and you have diverticulitis, you know what they'll do? They'll actually take your fiber away from you. You mean you should eat it when you have diverticuli, but don't eat it when you got a diverticulitis. So what's the deal here? So no, you should be plant-free, and then your diverticulum will not get inflamed and perhaps regress. So I would recommend avoiding all plants. QQQ, do you agree that having the COVID vaccine is a mark of Cain? What is the mark of Cain? Why egg yolks, asked Elsa? Because they have 100% bioavailability. Every nutrient that you need is in the yolk. People who have reactions to eggs usually have a reaction to the white, to the albumin, and then there's another protein. It also starts with an A, avidin. It is a protein in egg whites that a lot of people have a reaction to, but they usually will not have a reaction to the yolks. And the most important part of the egg is the yolk. For the chickie that's growing inside the egg itself, the white part is actually antibacterial, antiviral, antiparasitic, antifungal. That is the, for infection-wise, your immune system, whereas the yolk is the nutrients. Yes, real breast milk over formula, absolutely. You guys, if you are on Instagram or YouTube, please subscribe, hit the like button, comment. If you know somebody that maybe needs to hear some of these things that I'm talking about today, share it with them. And then it won't be coming from you. It's always hard to talk to somebody that you love and care about because they think that you're just nagging at them. But maybe if you send them a video and say, hey, let me know what you think, about this or that. Your doctor surely is not asking you these questions. They don't have time. They do not have time to be answering your questions in regards to diet. They will easily send you over to a nutritionist who has been indoctrinated with the same information that the doctors have gotten. It's deep, you guys. Elsa says, they said 4 years ago yolks were bad for us, but they lied to us. Well, because they thought that the yolks contained the cholesterol and that we should not eat cholesterol. But I appeal to you that we need cholesterol because cholesterol makes we talked about this yesterday. Every cell in our body, the membrane has cholesterol. We need cholesterol or else we would fall like a heap on the floor. We'd have no structure. Cholesterol is important for vitamin D production. It's important for our sex hormone production. It's important for our immune system. Without cholesterol, we would die. And for them to say that we should eat a low saturated cholesterol diet, never eat egg yolks, never eat red meat, was a lie. But it had some, it had an agenda, and that agenda was to sell products. And those products are medications that made billions and billions of dollars and caused millions and billions probably of side effect problems for everybody taking them. It's really unfortunate. Yes, Paget, eggs are really good for you. I'm on Ritalin. Is that bad? The fact that you're asking me the question, is Ritalin bad, should answer that question because it is a medication. It is manipulating a natural biologic process in your body over time. That Ritalin is a stimulant. It not only stimulates your brain, but it stimulates everything in your body. You are getting a sympathetic predominance of your nervous system, and overproduction of a sympathetic response is releasing cortisol. And cortisol can, 1, increase anxiety, but 2, it increases blood sugar, and blood sugar increases insulin, and insulin will increase your risk of coronary artery disease. So yes, taking Ritalin downstream can cause problems with a heart attack. Maybe not so much with coronary artery disease, but the fact that it can increase our risk of getting blood clots. And the blood clots, it's not that the medicine itself, it's just a process that's going on in our body when we are stimulating the sympathetic nervous system without any balance of the parasympathetic nervous system. So yeah, I think I would say, yes, Mark, exactly. Same with caffeine. But caffeine being, oops, how did that happen? Well, I guess I'm on green screen now. I have no idea how that happened, you guys. Tell me how that works. None. There we go. I don't know. Maybe the green screen was nice. I don't know how I did that. Okay. You guys, instead of having me read these things, put a QQQ in front so I'll know that. Oh, Robin said she was taking venlafaxine 225 milligrams every day, then stopped cold turkey. Felt like how they described a heroin withdrawal in the movies. Yeah, can't even imagine going off of 225. Wow. So yeah, if you guys got a question, put a QQQ and we can answer your questions. Otherwise, I am skipping over everything else. Fire Tiger says, thank you for your service and welcome to YouTube. Thank you. Okay. Yeah, they're coming. You guys over there on YouTube, I'm skipping over all of the comments over there because I don't think they're relevant to what we're talking about today. Oh, here's a good question. Have you read or heard about the new study on coronary artery disease and keto? I think you're referring to the keto CGA study. And no, I haven't completely read it. It is in regards to high LDL and causes for coronary artery disease. It also is talking about ApoB at high elevations, and it's basically how do I say? It's knocking down the hypothesis. It's not a theory. It's a hypothesis. It's still a hypothesis. It'll probably always be a hypothesis. That's why they call it the diet heart hypothesis. It is still alive today, the diet heart hypothesis, where saturated fat in your diet, high in cholesterol, will cause coronary artery disease. It later was changed to high LDL and cholesterol as a cause of coronary artery disease. Then there was the next buzzword of, ApoB as a lead up to coronary artery disease. But what I'd like to tell you, in case those of you do not know what ApoB is part of a lipoprotein. A lipoprotein is an LDL particle or an HDL particle. They're lipo, fat, and protein. So like LDL, HDL, those are lipoproteins. And we can measure them now in the blood, and we can actually measure their size. ApoB is on every LDL particle. It's also on triglycerides. So when you measure ApoB, you're measuring all of your LDLs, all of your triglycerides. So that number is skewed because you're measuring even what I would consider, and this is not even a thing, but you're measuring good LDL and bad LDL. Now, what makes an LDL bad? An LDL is bad when it's become oxidized or it's become glycated. Lipoprotein, Lipoprotein, lipoprotein is how you spell that, lipoprotein. So low density lipoprotein, LDL, high density lipoprotein, HDL. So every LDL particle has an ApoB, a protein on the LDL. An LP little a is also an LDL particle, and it has an extra protein called ApoA. The A is the A in LP little a. Now, what makes an LDL particle bad is ones that have become oxidized or glycated, and they don't circulate back to the liver and get used. They can actually get picked up by macrophages, and macrophages, once they consume, like Pac-Man, small dense LDLs, they become known as a foam cell. And we can see foam cells in plaque on coronary arteries. We can see platelets, and we can see other debris, white blood cells, red blood cells. We can see the starting of clot formation. Do these smaller, dense LDLs cause heart attacks? I don't believe so. Are they involved in plaquing in an artery? I do believe so. But they aren't the cause. Why do plaques start is because there's an injury to the endothelium, the lining of an artery. When the lining of the artery is injured, whether it be by microplastics or abnormal red blood cells like sickle cells, these can injure the lining of the artery. Sugar does it, smoking does it, alcohol, all these toxins, heavy metals, all of these toxins that are in our bloodstream can rub up against the internal lining of the artery, injure it, and then attract what I would consider a Band-Aid in simple terms. That Band-Aid is particles or debris like red blood cells, white blood cells, platelets, these small dense LDLs, whatever there, and they form a Band-Aid, and that Band-Aid can get calcified. Now, if it has a soft core, that is the part that we're worried about. We're more worried about a soft plaque than we are a hard plaque. The hard plaques can stabilize. Many, if not all, heart attacks are not caused at the area of injury. And there has to be so much narrowing to actually cause a blockage. And that narrowing is upwards to 70%. So if you have a less than 49% blockage, you're not getting your heart attack from that narrowing. You're getting your heart attack from a blood clot. There's a mess up. The injury cannot be repaired. The endothelial cells are dying. They're not releasing nitric oxide, which vasodilates arteries. There's a miscue between fibrin buildup and forming a clot and fibrinolysis, breaking down of that fibrin clot. So the fibrinolysis can't keep up with all of the clot formation over time. That clot breaks off, goes downstream, and we have a problem. Okay? Heart attack, stroke, goes into the lung, and these are the things that are causing our heart attacks, not so much the narrowing. If you were to look at somebody's angiogram, and especially people who exercise, they will, at areas of narrowing, they will develop collateral blood flow. It is a normal process. It's like branching out of a tree. So if there's no blood flow to a certain area because one of the large blood vessels in our heart, like the LAD or the circumflex or the right coronary artery, the RCA, if one of those is blocked, over time, your arteries will branch out and feed that heart with, blood flow. But not if there's an acute blood clot that blocks that. There isn't no collateral flow that's going to help that. Let's see. You guys are all talking to each other, I see. Okay. The thing about being on YouTube and Instagram, it's easier to read the questions because they actually come slower. But you guys over on YouTube do not. There's no color coding until I start getting super chats. I can't see when you guys have a question unless there's like big cues coming up. Robin asks, is there a way to heal brain lesions? What kind of brain lesions are you referring to? Hello, Serbia. Where are you guys listening from? There's a Serbia listening. You guys over on Instagram are now very quiet. What are we going to do about that? On the hypothalamus, lesions on the hypothalamus. What kind of lesions are we referring to? I'm sorry. Good morning, Phoenix. I don't know what time it is. It's morning here. Carla asks, can we get plaque everywhere in our body, or does it only happen in our brain? Plaque can happen anywhere in our body. It happens in arteries, Carla. It's a very rare condition that you will get plaquing in veins. The only place that you could possibly get plaquing in veins, from my perspective, or as far as I'm aware, is in the lungs, in the pulmonary veins. Otherwise, they are only in large arteries. They're not going to be in capillaries or arterioles. You get plaquing in large arteries. The brain, the heart, the peripheral vasculature, in the large arteries of the peripheral vasculature, like your iliac, your femoral, your aorta. Those are areas where you can get plaquing. Can you get plaquing where say you've had heart disease, you've had a coronary artery bypass graft, so you've had a cabbage, and they take a vein from your leg. The only other time that you can get plaquing in a vein is when you take the vein out of your leg and you put it in your heart, and now that vein, which was a vein and now is acting like an artery, can get plaquing. And it does. So you ask yourself, so I thought you said veins don't get it. I said that. But when you put that vein in an area of high pressure, like the heart, and it acts like an artery where there's high blood pressure, now you can damage that vein lining, just like you can damage the lining of your arteries in the heart. No, that's not true. Once I get super chats, I will still answer questions, but it makes it more easier to read those questions. And, there is some sort of financial gain by answering super chats. I mean, a super chat can be $1. So I don't think that has dissuaded people from asking questions. Aaron asks, what is the best diet for people with bad kidney numbers? Well, ask yourself how you got bad kidney numbers in the first place. Do you have diabetes? Do you have high blood pressure? What was your diet before bad kidney numbers? And then I would do the opposite. That's my take on it. Good question. Oh, we got another one from Serbia. What time is it in Serbia right now? Let me know. Where are you guys listening from on Instagrammers? I don't know where you're listening from. Some of your questions over on YouTube are being held for review. So that must mean that you're being naughty over there on YouTube. Here's another question. Jesus is king. Yes, he is. How do you break a fast? Well, first, I think we should talk about fasting. What is fasting and how long do we do it? How often should we do it? Fasting is common in many cultures, and it's become more in modern times used as a weight loss agent. And I can see where that would be if you don't take in any calories. Your insulin levels drop, your blood sugars drop, and you go into ketosis, meaning you will start burning your body fat for fuel. Most of us have excess body fat, so we'll be good for a couple months or more. I mean, there's a study that was done on a gentleman in another country. I don't know if it was Australia or New Zealand, somewhere outside of the United States, where he went over 365 days without eating. And he was medically supervised. I'm sure that they were giving some electrolytes, but maybe not. And he was eating off of his fat on his body. I think he was over 500 pounds. Don't quote me on this. The study is public, and they did it on this gentleman from another country where he did not eat for over 365 days. He didn't consume any food. He lived off of his own body fat. He was in ketosis 24/7. When we do not eat and we fast, we start going into ketosis. Some people will do 48. Some people do 72 hours. Some people do a week. Some people just do short stints of daily time where they'll fast for 16 hours and eat for 8, or they'll fast for 18 hours and eat for 6. And I think that's common. We have a strong tendency to, when we're in ketosis, to go through autophagy. And I believe that is good for us. That is the maid service coming to do some cleanup inside your body. Autophagy is good. I have a problem with people who limit their calories and are not feeding nutritious foods when they do come off a fast. When you come off a fast, the best way to do that is to avoid all carbohydrates. You weren't eating carbohydrates during your fast. You should not eat them after your fast. Your food should be predominantly fat and a little bit of protein. Rez says, can I cut my statins and prevent my high LDL by diet? My first question back to Rez is, why do you feel your LDL is a problem? We have to get past this LDL is the problem. And if you come back to me and say, but I have small dense LDLs, the way that you get small dense LDLs is because you were eating carbohydrates. So sugar in the form of glucose or fructose increase glycation or oxidation, and they damage LDL particles. Your LDLs are not a problem if they are the usable, light and fluffy LDLs that are doing their job in your body, which they have a job to do, and we do not need to limit them. But if you are telling me that you have a bunch of small dense LDLs, I would say, can I cut my statin? Yes. Because statins do not just lower small dense LDLs, they lower all of your LDLs. And you're lowering what I would consider functioning LDLs, and you're also lowering small dense LDLs, which are dangerous, that lead to oxidation. They get glycated, they get damaged, and they cause problems in our arteries. So first and foremost, what are you eating right now? What caused your high LDL? And second question I would ask you, why are you wanting to lower it? Have you had a nuclear magnetic resonance imaging study that would help determine the size of your particles? Maybe that would be the first step. Why doesn't America have free health system? Well, I don't know the answer to that. Andrew says, what can I do? I'm 40 plus, in age, 40 plus, to prevent atherosclerosis in the arteries of the brain in the future. Some diet, some vitamins. So again, what causes plaque buildup in arteries at all? And we went through sugar, which raises insulin. There's smoking, alcohol, nanoplastics, microplastics, heavy metals. These are the things that cause damage to the artery walls. Then the plaquing is a repair process. The plaque is full of debris. Platelets, red blood cells, white blood cells, macrophages, some cholesterol. All of these particles are involved in the calcification of a plaque, or the beginning of a plaque, the Band-Aid. So to prevent an injury would be to stop those things that I just was talking about. But you would have to stop drinking the water and stop breathing the air. in order to avoid microplastics and to avoid heavy metals that are in the air, you would have to basically stop breathing. And you cannot do that. But there are things that we can change, and diet is a big one of those. So a low sugar carbohydrate diet, if not any carbohydrate diet, because there's no essential carbohydrates, there's only essential fatty acids and there's essential amino acids. There are no essential carbohydrates. If I put you on a desert island and I only gave you animals to eat, you would thrive. But if I put you on a desert island where there's no animals and put you just with plants, you would die, and you would die much earlier than the person with animals on their island, because there are no vitamins and minerals on the island. A definition of food, by definition, it has to have nutritional value. It has to have every nutrient that it needs. So what you are talking about is, I got to supplement. If you have to supplement your diet with supplements, then that tells me that your diet is not nutrient dense. And so if you are on an animal-based diet, then you do not need supplements, because it is the most nutrient dense diet there is. Oh, it's 9:10 p.m. in Sri Lanka. Raymond says, don't you have a Cash App or PayPal or Zelle link in your description to get money, because YouTube makes a lot of money off of donations? I don't believe I have one yet. Again, I know this might sound crazy to you, I'm not sure, but yes, I want to make a living. But more importantly, I want to allow you guys to have enough information to make good decisions. Having the ability to make good decisions is very important. You cannot make good decisions if you do not have good information, or information in general. Even if the information that was given to you was not right, it gets you to look things up. And so my goal is to provide you with information so you're able to make good decisions. And I truly believe that you've been lied to your whole life about things like eggs are good for you and eggs are bad for you, and all of the flip-flops that have been going on. Even the things that, some of you have been talking about RFK, even some of the things that he is talking about, there's just a bunch of flip-flopping going around. And I really believe that we need to get educated and know, hey, what is truth? And sometimes we have to test it, and that's called hypothesis. And we form, hypothesis, and we test them, and there's peer-reviewed studies, and we don't even have peer-reviewed studies anymore. It's all bought and paid for, okay? And so, yeah, eventually, to answer your question, I can't remember who asked that, Raymond, but yeah, I in my description, I do have a PayPal link. I think I'm putting it on every live stream at the end, because I don't want it to be influencing anybody right now. If somebody gets done and they want to donate to my cause, yes, I am a physician, but I closed my practice. I have been in practice for 27 years. I worked for a corporate hospital entity for 10, 11 years. Then I worked for a walk-in clinic for another 5 or 6. And then I opened my own practice for the last 13 years. And just recently, I have closed my family practice clinic, and I have moved completely online, because I believe that we can reach more people online. I can talk to 3,000 people online. I can only talk to 15 people a day. I can talk to 3,000 in an hour, and I can talk to 15 in 8 or 9 hours. The amount of clickety-clack work that I have to do in order to make the insurance companies happy it's unbelievable, the amount of paperwork. And the big corporations have people in the background doing all of this. That's why The doctors of today in modern time, and it's been going on for the last 20 years, they make money on coding your chart. So if they clickety-clack the right number of boxes, they're going to get paid for a certain amount of basically documentation. They may have never even asked you your things. If you ever look at a doctor's note, you will be enlightened, because you'll know that. So if a doctor documents that they did a whole bunch of physical exam on you, like look in your ears and your eyes and comment on your pupils are equal, round, and reactive to light, and extraocular muscles intact, and they never really looked at any of that, but they'll document it because they get money. It's a checkbox. Then you'll really know what is going on. Let's see. Rez says my whole LDL is high. I'm not sure what you mean by whole LDL. You're just getting a lipid panel, Rez. So let me break this down for you. When somebody just gets a lipid panel, it's going to give you your total cholesterol, the LDL, the HDL, the triglycerides. The LDL and the cholesterol, from my perspective, is not worth looking at. I want to look at your triglycerides and your HDL. If the triglycerides are elevated over 70 and your HDL is low, less than 70, you have metabolic risk factors for a heart disease. When your triglycerides are high and your HDL is low, that tells me that your LDLs are small and dense. The only way you can get small, dense LDLs is via oxidation, glycation, by sugar, by carbohydrates. So if you have high triglycerides, that tells me you have high carbs in your diet. If you have low HDL, it tells me you have very, very little fat and you don't exercise. And fat in terms of saturated fat, animal fat. Animal fat will raise HDL. Exercise will raise the HDL. No carbs will lower triglycerides. That will change your particle size of your LDLs. So your LDLs become larger. They're small and dense because of carbohydrates. So if you want to just look at your lipid panel without doing, that's a poor man way of ordering an NMR, which can be expensive for some people and they don't want to go there. But a poor man's way is to look at the triglyceride to HDL ratio, and they should be 1-to-1 or less than 1. So your triglyceride should be 70, your HDL should be 70. That's a 1-to-1 ratio. That tells me that you're metabolically sound. If your LDL is 300, I would say that those LDLs are large LDL particles. We need to be metabolically sound. We have a risk factors for coronary artery disease, and it's from what we're eating. Lowering your LDLs is not going to prevent you. Good morning, Lucy. Lowering your LDLs is not going to prevent you from having a heart attack. Just look at how many people who are on statins, they take these medications to lower their LDL and they still have heart attacks. Why is that? You guys, you asked that. Answer the question. You guys over there on YouTube, hey, Instagrammers, this is what's going on YouTube. They're actually turning each other in over there. Crazy stuff goes on YouTube. But you Instagrammers, you're so polite over here. I appreciate that. You put cues in front of your questions. Is there a benefit to getting an NMR? Yes and no. When I say that it's a poor man's way, it's not that you don't have money to get the NMR. It's the fact that some people really want to be convinced that they do not have risk factors for coronary artery disease. There are many tests. Yes, you could get an ApoB. ApoB, again, in my opinion, does not matter because you're measuring all LDLs, even the big, fluffy, buoyant guys, the healthy guys. You're measuring big, fluffy guys and small, dense guys with an ApoB. You're also measuring triglycerides. So if you're eating a bunch of carbs and drinking a bunch of alcohol, your triglycerides are going to be elevated, so your ApoB is going to be elevated. Do you have a risk factor for coronary artery disease with that number? Yes, because your triglycerides are elevated and you have small, dense LDLs, leading to risk factors for damage to the arterial lining in your heart. Can you get a calcium scoring test? Absolutely. Get a calcium scoring test. It should be 0. You want a score of 0. And why are you on the most toxic app to be live on? Well, why are you on this app as well? I must ask that question back to you. That's a silly question. I'm glad you didn't put a Q in front of that. Yes, Rez, we do have a test for small, dense molecules. It's called an NMR. But just looking at your triglycerides will give us an idea. So triglycerides of 99 is bad, even though the average range is 0 to 149. Correct, Marnie. That is a good question. That range that you're talking about is referred to as the reference range. It even says that at the very top. It'll say REF range. Reference range. Lucy says, oh gosh, YouTube folks are rude. I just went there for a second, but don't like the vibe. Lucy, I think it'll get better over time. Again, this is new for them. And I think when you start ignoring them over there, the ones that are wanting to have their questions, they truly have a want and a need to get their questions, their health questions asked. They'll start filtering themselves out. And that's where the super chats are going to come in, because it's going to be valuable to get your questions answered over on YouTube. And again, Lucy, I appreciate you going over there and checking in. But again, it will filter itself out. So back to Marnie with a triglyceride level of 99. If your HDL is 99, that could be a good thing. But, you know, I like that triglyceride still under 70 or less. I want you to have carbs so low that your triglyceride levels are 70 or less. You can still keep that 99, but what if your triglycerides were 99 and your HDL was 40? That's almost a 2-to-1. Well, it is a 2-to-1 ratio. And so again, that puts you at risk. So just knowing your triglyceride levels doesn't tell me anything. I want to know your HDL level too. But simply looking at a triglyceride level of 99 is high. And they're telling you that the average range, which is a reference range, is 0 to 149. So what it's measuring is everybody that's come into that lab. And you guys know as well as I do that most people are sick, and most people that use the lab are sick. And your average is basically you comparing yourself with all of the sick people coming into that lab. A reference range is the average. So some people are at 149, and some people I don't think are 0, but they give a range of 0. That means absolutely nothing. Optimal range is 70 or less. So good question. That goes for everything. For reference ranges. So reference range for your liver function. The thyroid is even the worst. It has such a wide reference range that I believe it's keeping people from knowing that they actually got thyroid problems. And doctors only look at the TSH, which is a shame, because you could have a normal TSH and abnormal thyroid hormones. The TSH is produced in your brain, from the pituitary. It comes down and tells our thyroid to produce thyroid hormones, T3, T4. So our thyroid produces all of your T4. 100% of the T4 comes from your thyroid. About 20% of your T3 comes from your actual thyroid. The remainder, 80% of your T3, comes from the T4 converting in the periphery. That is pretty standard, pretty legit, unless, of course, you have high reverse T3. I know, all of these things. The T4 can also convert to reverse T3 instead of T3. And there's where we have problems, because reverse T3 can actually block the T3 receptors on the cell. So you do want to get a reverse T3 level. You also want to get a TG and a TPO. A TPO and TG are antibodies to your thyroid. You want to know, hey, do I have Hashimoto's? That's thyroiditis. Does metoprolol increase triglycerides? Yes, it can raise triglycerides. Medications have side effects. That's why I think prevention over medication is key. What is a super chat? Asked Lucy. A super chat is a paid question. Like, you guys can send, on Facebook, it's stars. So people on Facebook can buy stars and then give them as money. And on YouTube, it's called super chats or super stickers. And you buy super chats and you buy super stickers, and the person, it's just a way of respecting the person giving the information. It's a sign of, hey, thank you. It's just financially giving money to people you care about or think that they deserve to have money. Marnie says her HDL was 87. So again, that number, 99 divided by 87, is over 1. So your goal is to get that 99 below 87. This test was not fasting, though. When you get a triglyceride level, it must be in a fasting state. When you fast, you want to fast for about 12 hours. And over 12 hours can be a problem. It can actually cause a skewed result. Coffee in the morning can throw off your triglycerides. I think even exercising. So I tell my patients, do not exercise 3 days prior to getting your labs checked. That will make your liver function also more accurate. Marnie says, I've been keto since last summer. Maybe I need less protein and more workouts. It's a possibility that your protein content could be too high and not enough fat. Especially for women, there are some doctors out there that I subscribe to that will push a 2-to-1 ratio of fat to protein in women. So for every 100 grams of protein that you're consuming, 200 grams of fat should be consumed. So 2-to-1 in saturated fat, animal fat. Meat does raise blood sugars a little bit. So it's possible that if we overconsume protein, we can spike our glucose, which spikes insulin and causes, high triglycerides. Cortisol, having cortisol, like stress, can raise blood sugar, which raises insulin, can raise triglycerides. So those are just some of the things, even though you're not eating. I would get, Marnie, if it's possible, although this will skew it too. Yeah, that's a tough one. But I would say that ratio is pretty sound. But again, you need to do it fasting, and I would do 12 hours. Okay, over on YouTube, you guys are just talking to each other. Okay. Dr. Christie mentions that sulfur is needed to metabolize triglycerides. Expand on that, Dr. Christie. Yes, Marnie, stress has been huge. Ruth from Iowa, how should we lower cortisol? Cortisol is the result of a very overactive sympathetic nervous system. Sympathetic is our fight or flight side of our nervous system. When we are scared, somebody comes up and taps us on the shoulder behind us, we get scared, we get a rise in our catecholamines, and this raises blood sugar. Okay, so we need to get sugar to our brain or sugar to our heart, whatever it might be. It's a fight or flight reaction. And most of us live in chronic sympathetic tone, and we have very low parasympathetic tone. So sympathetic is fight or flight, parasympathetic is calming or relaxation. And if we are constantly in a state of sympathetic tone, our cortisol, our catecholamines are always going to be elevated. That's always elevating our blood sugars and can cause insulin resistance. If we practice doing parasympathetic tone, breathing, vagal nerve exercise, you can look them up, Ruth. They're just referred to as vagal tone exercises or parasympathetic tone exercises. Those are the things that you might want to look into. Let me see. All right. So lowering cortisol is lowering stress. Okay? Getting sleep, standing barefoot on the ground, getting out in the sun, going out in nature, praying, meditating, doing the things that calm you instead of continuously being in sympathetic tone. Remember, heart attacks can be caused simply by stress. And most people say, I'm not stressed because they're so used to being stressed. They don't even know. So that time when you think somebody comes up behind you and asks, or taps you on the shoulder and you just turn casually and look at them, like, what did you need? You're so dulled by chronic sympathetic tone that you don't even get scared if somebody comes up behind you. That's not good. That means a lion can come up behind you and nibble on your ear without you even realizing it. We need a combination of sympathetic and parasympathetic tone, or we're going to be very sick. In fact, during our parasympathetic tone, when parasympathetic nervous system is activated, we actually have nitric oxide released. And nitric oxide helps to take care of free radicals. Free radicals lead to chronic oxidation and chronic inflammation in our body. So again, this is that stress heart attack that people can have. JM, I do not know your question about the debridement surgery, but I appreciate you asking. Ruth from Iowa is asking Dr. Christie, how is her dog Tito? Tito ate a bar of soap yesterday. So Ruth, hopefully that answered your question on how to lower cortisol. Relaxing techniques, doing exercises, breathing exercises, sighing, humming. Those are just some of the things. Like I said, get outside. Get outside. Get away from your blue lights. Get away from the indoors. We're being trapped indoors through our jobs. Okay, you guys. Are there any other questions? You guys have any other questions? Back to the fasting question. There is no right or wrong thing on, there's no right or wrong process on fasting with the exception of how you end your fast. Remember, the reason I'm telling you not to end your fast with carbohydrates is because you have been fasting. When you fast, you are in ketosis. When you fast, your insulin levels drop. When you fast, you now become very insulin sensitive. Meaning, if you take in sugar to end your fast, it is going to go right into your fat cells. It could encourage fat gain after a fast. Do you want your fat cells to get fatter? No. Hypertrophy of fat cells is not healthy. Hyperplasia of fat cells can be healthy. But large hypertrophic fat cells are inflamed and they're pathologic. The most pathologic fat cells we have are those that are interior, inside our body, inside around our organs, in our abdominal cavity. Fatty liver is pathologic. Fatty liver is destroying the remainder of your body. The reason you got fatty liver is because you have lipogenesis. Lipogenesis can only occur in the presence of high insulin. High insulin can only occur in the presence of an injectable insulin or eating carbohydrates, eating sugar. Eating sugar will raise insulin. Insulin drives fuel into cells, cancer cells, fat cells, muscle cells, eyeball cells, all cells. High insulin drives the fuel, the energy, into cells. If insulin is low, you start burning. You burn fat. Okay? Those are good questions. Robert asks, should anyone eat vegetables? Should I eat any vegetables? Robert, there are no essential vegetables. There are none. There's essential amino acids. There's essential fatty acids. There are no essential carbohydrates. Robert asks, is there a difference between healthy body fat and unhealthy body fat, like yellow fat versus brown fat, or is that sort of like inconclusive? Okay, so as far as fat is concerned, we have subcutaneous fat. That's the fat that lies right underneath your skin, subcutaneous fat. It's like the fat that's on the back of your arms, the jiggly fat. Subcutaneous fat is not as pathologic as visceral fat or even deep subcutaneous fat. So we have subcutaneous fat, deep subcutaneous fat, and then we have visceral fat. Visceral fat is the most pathologic fat. All fat secretes hormones. It is an endocrine gland. It's an endocrine organ. And so with that being said, hormones being released from visceral fat are bad hormones. They increase our risk of getting blood clots because of the type of hormone, tissue plasminogen activator inhibitor 1. That is a hormone that increases our risk of blood clots. When you inhibit TPA, you are going to increase your risk of blood clots. If you have some sort of blood clot disorder like prothrombin mutation or factor V mutation, you are at extremely high risk for blood clots. If you take testosterone, and that increases your risk of blood clots, it increases your hematocrit, it increases the number of red blood cells, it increases your platelets at times. You are at risk of getting blood clots. Pack that in with visceral fat, which blocks TPA inhibitor 1. You are a setup for blood clots. You're a setup for a heart attack or a stroke. Subcutaneous fat actually releases a hormone that can be safe or healthy. Deep subcutaneous fat is just like visceral fat, and it releases bad hormones. There are thousands of hormones released from our fat. I just named a couple. Leptin is another one. If we didn't have leptin, we would not be fertile human beings and be able to have babies. But we can have leptin resistance. So these are going down deep rabbit holes. But suffice it to say that fat makes hormones, secretes hormones in our body. Some good, some not so good. That can cause problems. And we need to be aware of that. Now, white fat differs from brown fat because brown fat is metabolically active. Babies have brown fat. And it is metabolically active because of the number of mitochondria. The more mitochondria, the more metabolically active the tissue is. Same with red meat. Red meat is red because of mitochondria. Mitochondria are power stations. They're active, metabolically active, doing their thing. Brown fat is like having super duper metabolism. It's burning heat. It's burning and making heat. White fat is not metabolically active. Is there a possibility to turn white fat into brown fat? Yes, there are studies going on that have looked at converting white fat to brown fat, which is not a true conversion, but maybe an in-betweener called beige fat. And they've done studies on cold therapy. So these ice baths that people are getting into helps to change some white fat to metabolically active beige fat. Just the simple act of going out into like extremes of cold temperature can help change some of your white fat to brown fat, which is beige fat. So there's going to be more mitochondrial function. Yes, Christian, mitochondria is the powerhouse of the cell, but it's more than that. The mitochondria are as far as a cell is concerned, cell health is a lot of times based on the mitochondrial health. If your mitochondria are unhealthy, your cells are unhealthy. And there's numerous ways that your mitochondria can become unhealthy. Diet is a big one. Iron overload, smoking, alcohol, all of the things that I've mentioned in the past that cause insulin resistance, eating processed foods, polyunsaturated fatty acids, high in omega-6, linoleic acid. They're damaging to our mitochondria. The mitochondria have a membrane around them as well. It's similar to the cell membrane itself. So if the cell membrane has fat and cholesterol, saturated fat and cholesterol, the mitochondrial membrane also has fat and cholesterol. If you damage the mitochondrial membrane with polyunsaturated fatty acids or insulin resistance, you've basically destroyed your mitochondria. You've made them unhealthy. And our body will tend to get rid of those. But the process, sometimes we have so much destruction of mitochondria that we can't keep up with production. That's a good question. Thank you. I don't know if we've heard from Dr. Christie in regards to her dog or the triglycerides. I'm interested in that one. Here's a question from Riza. How do you differentiate visceral fat from subcutaneous fat in your home without really any medical diagnosis? Okay, so if visceral fat is fat in the abdominal area, you can get fatty heart too. So let's just call it from the waist up. You can get fatty tongue. That is viscera. That is an organ. So you can get fatty tongue. Fatty tongue develops the same way that fatty organ disease, fatty liver develops. It's from high insulin. High insulin is from high blood sugar. So anything that elevates blood sugar above what you can take in from a sensitivity standpoint causes fat cell growth. If I want to determine whether or not you have fatty organ disease, fatty liver disease, I will look at your insulin level. If your insulin level is over 5, your risk of having fatty liver disease is very, very high. Fatty organ disease. Another cue to me is a beer belly. A beer belly, they have this big giant belly like they're pregnant, especially these men. Women, it seems to be more or less square like SpongeBob. But if you look at yourself and you have a big belly in the mirror, that and skinny legs, skinny arms, you have fatty organ disease. Your fat is growing so much inside your belly, it is pushing out, okay? I've even seen it in bodybuilders. They're eating so much carbohydrates, so many calories. Their insulin level is sky high, and many of them are actually taking insulin in order to push the amount of food that they're eating into the cells so they will grow. They will have a six-pack and a distended belly. That distension of the belly is organs growing and fat growing on those organs. That is death waiting to happen in the near future. It is very, very dangerous. So the mere fact that you look at yourself in the mirror and if you have a beer belly, that is a strong indication that you have fatty organ disease. If you look down and you cannot see your toes and all you see is belly or other things that you look down at, yeah, fatty liver disease. If you have an inner tube around your belly, that is fatty liver disease, fatty organ disease. So what you really need to do to see if that area is going down in size is actually to do a measurement of your waist. So if you take a tailor's tape and you lie on your back, knees bent, and you wrap the tailor's tape around your belly loosely about the area of your belly button, your umbilicus, you measure that and you watch the size go down. You might not be losing weight, but if your waist to height ratio is going down, that's a plus, okay? QQQ from Esvit, is high sensitive CRP a useful test? What range is healthy? A healthy range for a high sensitive CRP is less than 1. Any CRP over 1 is unhealthy. It's an inflammatory marker. HSCRP, high sensitive CRP, is highly sensitive for the heart arteries. And yeah, you want a low less than 1 CRP. I think everybody should get a CRP because I think seeing numbers, especially initially, getting labs checked, I think is important because a lot of you respond favorably by looking at labs. If you know your numbers, you can relate to that. If somebody knows how to interpret them, which that segues me into, if you want to consult with me in regards to your labs, go over your labs line by line, talk about your medications, talk about your health, your medical history. You can sign up for a consultation. Just email me at IronLadyDoc@AOL.com. IronLadyDoc@AOL. If you email me at AOL and you want to sign up for a consultation, we'll get you set up. I'll send you some forms so I can make a progress note for you, a chart, and we'll talk about your things. We'll talk about your labs. We'll go line by line. Expect to take for it to take an hour. It's not something like where your doctor gets your labs and then the nurse calls you and said, everything looks fine, I'll see you in a year. Everything doesn't look fine because they're looking at your reference range. And that range could be very, very wide. And you'll fall inside of that range and they'll call you normal when, in fact, you're not normal. Another way to decide whether or not you have fatty liver disease is to look at your liver function studies. On a CMP, a complete metabolic profile, is a value for AST and ALT. Those are liver enzymes. And when an ALT is especially elevated, that indicates fatty liver disease. Will you have a high sensitive CRP that could be elevated with fatty liver disease? Yes. Yes, you can. So is high sensitive CRP supposed to be sensitive for the heart? Yes. But is it sensitive for all over body inflammation as well? Yes. You could have an infection. You could have a cold. You could have a pimple on your butt and your CRP will go up. That's how nonspecific it is. But we still get it. It is eye-opening for the person to see, oh my gosh, my CRP is 7. I am so inflamed. Yeah, that explains why I got rash on my face. It explains why my joints hurt. It explains why I got blurry vision. It explains why my bowels, I'm bloated and gassy. It's the food you're eating that's causing inflammation. Anytime you eat, you can get inflamed. But you see, our body is very good at taking care of that if we're not constantly eating inflammatory foods. But many of us in modern Western nations, we are eating a westernized diet full of processed foods, of seed oils, and sugar. We are a sick population. We're getting sicker. And they're telling you not to eat meat, not to eat eggs. They're telling you to eat fruits and vegetables. What? Fruits and vegetables made in a lab? They're made in a lab. The seeds are made in a lab by a man. They're not real. Ruth says my AST range was 10 to 35. Yeah, that's right. That's the range for reference range, but the results showed as 16. Somewhere around 10 to 15 is a normal range for an AST and an ALT. If you're really wanting to know about fatty liver, get an ultrasound. Get an ultrasound of your right upper quadrant and specifically ask the radiologist to mention fatty liver. Oh, I've had an ultrasound before. No, they never mentioned it. Why didn't they mention my fatty liver? Because everybody has it and they get sick and tired of talking about fatty liver because everybody's got it. So they probably think it's normal. It is not. It's choking out your liver. You are at risk for fibrosis, which is scarring of the liver, which leads to cirrhosis, non-functioning liver. Or worse yet, you get hepatic cancer. I don't think you guys want that. So we're not looking. Do you know how many people in my past, before I knew how to read liver enzymes, I let 40 level go when that person needed to be addressed in regards to fatty liver disease. But if I didn't know it, how's the patient going to know it? That's why we as physicians, whether MDs or DOs, need to be well versed and need to learn things that we have never been taught. They never taught us to decipher liver enzymes. They said, oh, it falls in the normal range. That's not normal. That's a reference range. SFIT, please repeat your email address. Ruth just wrote it down. IronLadyDoc at AOL. IronLadyDoc at AOL.com. Thank you, Ruth, for writing that down. So not only should you get an AST and an ALT, you should know what your bilirubin is. You should know what your GGT level is. These are good if you want to know, hey, how bad is my liver? We can also get a fibroscan on your liver. But first, I just start with an ultrasound. Sometimes, incidentally, it will be found on CT scan, and the radiologist will mention fat around the liver. Sometimes, most of the time, they don't. Okay. George says he's good with genetically modified food. Okay. Well, at least he has enough information, right? Instagrammers, to make a good decision. So he decides that GMO is good for him or won't hurt him, whichever. Ruth asks, are there any tips to get doctors to take you seriously? I nearly died with them ignoring me. As far as what type of problem did you have? I guess I just need more information. Oh, yes, George, I would wholeheartedly agree with you about contaminated soil. I live in Iowa. I am in Iowa. I'm a family practice physician in Iowa. And we are known for our monocropping. Just like Nebraska, Oklahoma, we are monocropping capital of the world. So we continuously are stirring up our soil and we're losing our topsoil. Back in the day, in the 1800s, the topsoil was 6 inches, at least 6 inches. Now it's not even an eighth of an inch. So when you have no topsoil, you basically have just kind of raw dirt. And raw dirt can grow weeds. And so that's why all the farmers have to contaminate their land with glyphosate or other pesticides, herbicides to try to get rid of all the stuff that's growing because they're ruining our land. Yes, they are ruining our land. They're monocropping. And for anybody who's got this heart that bleeds for that everybody should be a vegan because we don't kill anything, Do you know how much is being killed by Iowans monocropping their land, killing all of the microenvironment, all of the worms, all of the snails, all of the thises, all of the deer? The deer have nothing to eat. There's no little groundhogs. Everything is being killed either by the tilling or by the poor soil because they're going to put chemicals on it. And then you consume it or you put it in your gasoline tank. That's what Iowa's known for, ethanol. We're going to turn our corn into ethanol and put it in your gas tanks and watch everything rust from the inside out. I know that Iowa makes a living on their crops, but they're killing our soil. And eventually, there's nothing that will grow on it. Will I be alive? I don't know. But how can we get back? You start grazing animals. You start regenerating the land. Oh, we don't have time for that. Oh, so you're just going to continue poisoning the people and poisoning yourself. You're around it. But there's nothing else I can do. I need the money. You need the money that bad that you would poison a population and poison yourself? See, that's where I don't understand. I don't understand. But if you put, like George says, if you start adding manure to the land, if you allow and you rotate crop and animal, you start to regenerate the land and the topsoil starts to regenerate. But, Julia says there needs to be a study about how anabolic steroids affect the pancreas. They cause fatty pancreas. It is what it is. Anabolic steroids are just your, basically normal, I would say normal sex hormones that have been jazzed up, so to speak, and taken in overload. So taken in super physiologic doses. Do you not think that it's going to cause problems for all of your organs, including your heart? Ruth says, I essentially nearly died. It wasn't taken seriously when I lost it. You guys, they go so fast. Went to the doctors 3 times as I was essentially in oxygen failure, permanent organ damage. And they were like, I don't know what it's going to take. I think if I were you at that point, maybe going to the emergency room and getting tested, because seeing a PCP I'm not sure why the doctor didn't take you seriously. It's hard to comment. I wasn't in the situation, so I don't know. I take TRT. It's great. I would have make sure that you get a Stuxy 87 about your, no, it's gym time. Sorry. Gym time. If I were you and you're going to take TRT, I would have your doctor get a factor 5. I hope you have a pen to write these down. Make sure you get a factor 5, and it's a Roman numeral number 5. So factor 5, get a prothrombin mutation. It's another test for blood clot disorder. Make sure you get a CBC, and then of course get your testosterone and your estradiol. But get those, your platelet count, get a AST, ALT, a GGT, get a factor 5 and a prothrombin mutation. Make sure that CBC has, make sure you're getting a hematocrit and a hemoglobin. So hopefully that helps gym time. I would definitely get that. I would want to assess your, you can make the decision if you want to take TRT. That's fine. I just want you to be proactive and ask for things so you don't risk having a heart attack or a stroke. Or maybe it doesn't bother you. So I understand. Autoimmune pancreatitis. Are you referring to type 1 diabetes? Which part of the pancreas were you having an autoimmune reaction to? Some of you over on YouTube have really good questions, and I appreciate that. Yep, you're welcome, gym time. I just want everybody to be safe. If you decide to take TRT, I just want you to be I mean, I have young, see, that's another thing. Gym time, if you go to your doctor and you actually tell them you're on TRT, and if they are that ignorant, they can't tell if you're on TRT. But again, I have TRT patients that just take it for longevity, and I don't think they've lifted a day in their life. They've never lifted weights. They don't even exercise. So, but if you're an athlete, you're exercising, you're lifting weights, you're taking TRT, you're going to have increased muscle mass. And for a doctor not to quite realize that, there's something wrong with the doctor. But a lot of times they will deny you your labs. So I don't know where you're from and why do they deny you? Because they don't want, they'll just tell you, that's not good for you, don't do it. Well, as doctors, we need to, that would be like saying, you have HIV, you can't come to my office. You didn't get a COVID shot, you can't come to my office. It's not right. We are not making that decision. We are supposed to uphold the oath and take care of patients. So if a patient came to me and says, I want a lab list this long, I'm going to say, okay, we may not have diagnoses that pay for all of that. Are you good with it? Oh yes, I'm good with it, doctor. Then I need you to sign this form. And what the form says is that whatever your insurance doesn't pay for, you will get the bill. Yep, I'm good with that, doctor. But for a doctor to just completely flat out saying, I'm not ordering that, that's not right. I had one patient who, or told me they're not a patient went to their doctor, asked for labs, they didn't get them, and the patient said, I'm not leaving until you get my blood and order these lab tests. So that angers a doctor because they need your room to see other patients because they're on a time scale and they need to keep moving. And so, yeah, you kind of piss them off. Now, just the fact that they start drawing your blood does not mean that they will get those labs that you've requested. They'll still decide what they think is in your best interest, as if they know. But you have done some research and you want certain labs, so you should ask for them. If they will not get them, if you're in the United States and you need your labs checked, email me. I can order your labs for you. You'll get a discount. I don't make money off of me ordering your labs. I'm trying to help you out. I think it's important that you get your labs. So if you want your labs checked and your doctor will not order them, like gym time, if he goes to his doctor and he said, I want I want a factor 5, a prothrombin, I need a CBC, I need a CMP, I need these things, and the doctor says, I don't take care of people like you, or you don't need those. If you're going to keep taking testosterone, it doesn't matter if we check your labs or not. That's just plain dumb. That's a condition of ignorosis. Osis means a condition of ignorance. Get the labs. You work for the patient. The patient does not work for you. You make money off the patient, but they do not work for you. So if a patient comes in and they request labs, get the labs. If you're a doctor listening to me right now, just order their labs. But again, if you guys are in a situation where you cannot get your labs checked, just email me. I will order it. I'll have it sent to your email. My email address is IronLadyDoc, IronLadyDoc, all one word, IronLadyDoc at AOL. I will order your labs. They will come from a third-party lab. You can pick whatever lab draw station is in your area. You can tell me what you want drawn. I will put it into your cart like an Amazon cart, and then you will pay for it. I have no involvement. I will get the results because it's set up like that. If you want to schedule a consult with me, I'll go over your labs. Like, what do they mean? I can do that too. But if you simply just need your labs checked and you know how to read them, email me and I will order them for you if your doctor won't. Chat with Lucy. I do not know about your signal on Instagram. Kidney biopsy results, amyloidosis, going to be treated with a round of chemo. Well, get her done then, right? Get her done. All right. Are there any questions I missed over here? Ruth says, is blood pressure a good indicator of health? Mine is always high, 158/90. Ruth, I do not know how old you are and how long you have had high blood pressure, but over time, our arteries become like lead pipes and things do not move, and you will have elevations of your blood pressure. The farther away that your two numbers are, like 160/90, so if they tell you that the normal is 120/80, there's something called a pulse pressure. A pulse pressure is the top number minus the bottom number. So 120 minus 80 is 40. That is the pulse pressure. So the wider your pulse pressure gets, the more stagnant your blood is. That means that the muscular layer of your arteries is not working very well. So you're at very high risk of blood clots. Your blood pressure is also elevated because your insulin level could be elevated. Insulin, metabolic syndrome, metabolic disease, raises our blood pressure, raised because of our insulin. Insulin holds water, insulin holds salt, blood pressure goes up. Over time, the arteries under so much pressure get damaged. Pulse pressure is a great way. So a 158/90 is over 40. So your risk of having blood clots increase as those numbers get further and further apart. So 200/100 is not a very good pulse pressure. That person is at risk for a stroke due to a blood clot or a heart attack. So it's very important to know. A lot of times the doctor, you know what they'll do? Oh, you have essential hypertension. Essential hypertension means we don't know why you have hypertension and we're not going to look, but here's your medicine. So if you want to lower your blood pressure, lower your insulin. What is your insulin level? Is the normal insulin level or an optimal insulin level is between 3 and 5. Check what your insulin level is. What are your triglycerides? If your triglycerides are elevated over 70, it tells me that you're eating a lot of carbohydrates. And that carbohydrate could include alcohol. Okay. Are there any other questions? Let me... Looks like that's it, you guys. I think what we'll do is we'll call it quits today. And Lord willing, I will be back on Saturday, 9 a.m. Central for a live stream. And then Sunday at 10 a.m. Central. So share this with your friends. Share it with your coworkers. Share it with your neighbors. If you find the information is... Hello, Pip Keeper. Learn in life or 110/60 pulse pressure is riskier than 118/90. Can be, yes, absolutely. So that pulse pressure of 118/90, some people would say that that is better, but we also have to think in terms of diastolic heart function. And so that's another, oh, 158/90. Yeah, that's not good. But 110/60, yeah, that because your pressure is lower actually is going to be healthier. The fact that hers was 158/90 puts her more at risk. Good question. Okay, so next Saturday, 9 a.m. Central, Sunday, 10 a.m. Central for live streams on YouTube and Instagram. For consults, email me at IronLadyDoc@AOL.com. It'll be in the description, my email address. I'll also post the PayPal thing for you guys if that is something that you want to support me. I would appreciate that. But the way you can support me in other ways that are not financial is like and subscribe, comment, share stuff, and chat with Lucy. You're very welcome for the education. And I will send my mom your amore, which is, I'm guessing, an amen. All right? So you guys have a great rest of your Sunday. See ya.